The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. We can get started now. First and foremost, I'd like to thank you for taking the time to join us this morning. I know it's a very busy time for all HR and finance professionals as we head into the latter part of the year, so we appreciate greatly your time and attention this morning. My name is Mary Kay Wagner, Client Executive at the Fidelity Group. Today, we're going to be talking about an important topic concerning engaging and empowering your Medicare-eligible employees. Before we get started, I'd like to go over a few items to help you maximize your participation in today's event. You may have joined the presentation through your computer speaker system by default. If you prefer to join by telephone, just select phone call in the audio pane and the dial-in information will be displayed. You'll also have an opportunity to submit text questions to today's presenter by typing them into the questions pane of the control panel. You may send your questions at any time during the presentation. We'll collect them and address them during the Q&A session at the end. Today, we are privileged to welcome our presenter, Kathy Hirko, founder and president of the CAS Company. Kathy is one of Ohio's leading experts on Medicare. She's represented a multitude of companies for over 12 years. You might have seen her featured on WKYC or WEWS on Sunday mornings, or heard her on WTAM radio. Knowing that Medicare can be an overwhelming and confusing maze, she works with people to try and find them the plans that best suits their needs. Kathy's dedication to helping and education extends to her service to various boards and nonprofits. She's founder of the annual Fox 8 Stuff the Bus campaign and co-founded the Kids in Need Resource Center. Kathy is an active board member of Boomer and Beyond and Coats for Kids. She was a member and co-chair of University Hospital Senior Network Board. Fidelity has had the pleasure of partnering with Kathy and her team to bring them into the Fidelity Group family. It's been a privilege to join forces with Kathy. I've truly learned so much and look forward to our future together. Thanks for being here for us, Kathy. I'm excited to share today's agenda with you. Kathy will be covering the following topics. First, we'll be kicking things off with the common dilemma HR staff are encountering, which I'm sure you can all relate to. We'll then talk about some recent updates, followed by Medicare basics. This will serve as a strong foundation before Kathy covers helpful strategies and resources to share with eligible employees. Finally, we'll open it up for questions and answers. So starting off the HR dilemma, how did we get here? For the vast majority of people, the healthcare system and benefits in particular is a very confusing, complex maze. Most people spend the vast majority of their career accessing healthcare through their employer-sponsored health plans. This makes the role of the HR professional a critical piece of the healthcare system. And while we spend the majority of our careers relying on our employer-sponsored benefits, once we reach the age of 65 and shift towards Medicare, we're often left with very little in the way of resources and information about how to even start the Medicare process and how to make the best decisions for ourselves and our family. We at the Fidelity Group and CAS believe that this can and should be different. We believe that all employers and HR professionals fall into a unique position to be able to empower working Medicare-eligible individuals or those retiring and heading into the next phase of their lives to navigate the Medicare system in a way that's helpful to them and allows them to improve their decision-making power. We believe HR professionals are often left with very little in the way of resources, and our goal today is to provide you with support and assistance to empower those individuals. And that's really what today is about. We think this is an important conversation, certainly with Northeast Ohio and Ohio in general being what they are. but also with the strain that is being placed on working folks and folks that may be interested in retiring. We believe that makes this conversation extremely timely, and we're excited to share some valuable information with you. With that, I'd like to hand it over to our presenter, Kathy Hirko, to start an overview of the HR dilemma.
Thanks, Mary Kay. And thank you, everybody, for joining us this morning. The first thing I would like to say to you is if you are confused by the whole Medicare issue topic conversation, you're very normal. 96% of the people come in and say, the more I read, the more confused I get. So CAS Company is here to help people understand options and educate you to choices that individuals have as they approach Medicare. What is the HR dilemma? The facts are more than 78 million baby boomer retirees expected to exit workforce in the next 20 years. The pandemic and inflation has had a profound impact on retirement. Almost half, 48% of those who plan to retire in 22 are reconsidering or have put that on hold, and 40% of boomers plan to work until they drop, according to the AARP survey. And here's what I hear all the time. What am I going to do? Sit home and watch TV? So they plan on continuing to work. 47% of Medicare beneficiaries and 57% of those nearing eligibility admitted that they are overwhelmed at the idea of finding the right plan. Many of those nearing eligibility don't know where to start, 47%, and say official resources like Medicare.gov are very confusing. Very common statement. 19% of Medicare beneficiaries enrolled in plan without any outside help. The common statement is, my friend told me to get this, my sister told me to get that, and they finally end up in the wrong plan. Half of Medicare beneficiaries, 51%, and 3 in 4 Americans nearing eligibility, 72%, will choose a plan based on affordability, especially in today's day and age. Many of them are afraid because of what's going on with the economy. To give you some Medicare updates, here are some things that are relatively new in the world of Medicare. The Inflation Reduction Act of 2022. What is that? One of the most common medications that tends to be very expensive is insulin. And there are many people out there that are on insulin. So a cap has been put on the cost for somebody to pick up insulin. Now their insulin cannot cost them any more than $35. This is for 2023 when they pick them up, because when somebody picks up medications, they have a copay. Another nice thing is there is a zero copay for vaccines. We used to get a lot of phone calls. Why does it cost so much to get a shingles shot? Next year, it will be a zero copay. Flu shots, their vaccines will be a zero copay. There are some additional Inflation Reduction Act items that are going to come into play, but those won't come into play until 2024 and all the way up to 2026. Phone call recordings. What is that all about? Well, the first thing I'm going to say to you is we can thank J.J. Walker and Joe Namath for causing all of the confusion. As of now, as of October 1st, we as agents, when we are talking to somebody about plan specifics, we have to have the phone call recorded. The reason for this is if there is confusion with the individual down the road and they would contact Medicare, Medicare can now come back to the agent and say, we'd like to hear your recording to make sure that it is done properly. Unfortunately, I don't know if it's going to stop the commercials that they see, which are causing a lot of commercials, but we are now doing phone call recordings. And why do I tell you that? Because sometimes with a lot of scams, people go, well, why do you have to record this? It is a Medicare rule. In addition, there will be a disclaimer that the individual will hear stating that due to the rules and regulations, the call will be recorded. Part A premiums, deductible, and co-insurance are all increasing. However, Part B premium and deductible are decreasing. And as long as somebody is paid into Social Security and Medicare, their Part A premium will be zero. So what are the basics of Medicare? Medicare is a federally health insurance program eligible for U.S. citizens and legal residents. It is funded in part by taxes you pay while working, and it is individual health insurance. Funded by taxes they are paying. If somebody has not paid into it for 40 quarters, which is 10 years, there is a cost for Part A. If they have paid into it, it costs them nothing. And it is truly individual. When we meet with a couple, we will tell them we are accustomed to being on family plans, we're couple plans. Medicare is very individual. The plan that works for one spouse may not be the plan that works for the other one. And we help them to understand their options. What Medicare is not, it is not a family health plan. It is not Social Security. It is not Medicaid. Medicaid is for impoverished. And it is not free. There is a cost to Part B and then a supplement and or Medicare Advantage plan when somebody chooses the particular plan. I will tell you, in case anybody asks you, Cass Company is not Social Security. And the Fidelity Group is not Social Security. We can answer some basic questions, but we can't get into detail. Social Security consists of retirement, disability, and survivor benefits. People can start receiving benefits as early as 62 or as late as age 70. Full retirement age depends on your date of birth. The longer you wait, the higher your monthly benefit will be. And you can get Social Security retirement benefits and work at the same time. However, if somebody decides to collect Social Security before their full retirement age, they are limited to how much money they can make. Once they hit that full retirement, they can make as much money as they want. That is a Social Security rule. That is not a Medicare rule. And as you can see from here, depending upon the year you were born, that will tell you what is considered your full retirement age. And it does vary, and we do recommend that people pay attention to it. And they can go online and establish a Social Security account for themselves if they want specific information. Who can get Medicare? U.S. citizens and legal residents. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. Age 65. At age 65, somebody can go on Medicare. They do not have to be collecting Social Security. That is one of the biggest pieces of confusion for employees. I don't want to retire and I don't want to collect Social Security. I cannot get Medicare. That is not true. They can apply for Medicare, and there is a premium for Part B. And if they're not collecting Social Security, they will receive a bill in the mail for their Part B premium. Younger than 65 with a qualifying disability. At any age with a diagnosis of end-stage renal disease or ALS is eligible for Medicare. And again, they must have worked and paid taxes for at least 40 quarters or 10 years. And I have had people say, I've worked 36 quarters. Is it worth it to go the extra? And I say, most definitely it is. So we get this question a lot. What is Part A? What is Part B? How come there's Part C and I don't understand Part D? That's where we come in. And please know, you do not have to be responsible for answering these questions. All you need to do to make your life easier is pass on our information and we will explain it to individuals. Part A is hospital. Sometimes people will get Part A and they will not get Part B. Part A covers inpatient hospital care, home health services, skilled nursing facility care, and hospice care. It is premium free as long as you have paid into the 40 quarters. There are deductibles and copays, and no, you cannot be denied coverage. What is Part B? Part B is physician visits, outpatient services, preventative services, medical equipment, home health visits. There is a monthly premium and it is income-based. It is based upon the individual's income 2 years prior to when they want to go on Medicare. So if they want to go on Medicare in 2023, Social Security will go back to their tax return for 2021. And it does vary if you file taxes married joint or married separate. But again, this is not something you have to worry about explaining. We can explain it to the individual.
Kathy, does that reset every 2 years? So if I file for Medicare now and my income goes down 2 years from now, will my Medicare premium be reset then?
Traditionally, it should reset every year.
Every year, okay.
And another thing is when people are retiring, we have some high earners will say, I'm not making that money anymore. They can't appeal it. Doesn't mean that it's going to be granted, but if they can explain that their income is dropped because they're not making, they've now retired, they can't appeal it. And again, that's done through Social Security. It is, if you are collecting Social Security, they will deduct the Part B premium from your Social Security payment automatically. If not, they will send you a bill and you can either then go online, pay by credit card or check. And if somebody goes on Part A, does not go on Part B, and does not have credible coverage in the eyes of Medicare, when they go on Part B, there would be a late enrollment penalty. And I will share with you that we do tell the individuals when they go, well, I don't know if I have credible coverage, that they should either talk to their HR person, the benefits individual for the company, and if you don't know where to go, then for you to reach out to the individual that handles the group insurance. That is a very important piece of paper for the individual to have.
I'd like to also add that once someone turns Medicare eligible, COBRA is not considered creditable coverage. So they would have that penalty assessed unless they get other coverage other than COBRA.
And I will share with you that there is a big movement in Washington to try and get COBRA as considered credible, but that's hasn't been granted yet. Medicare does not cover everything. Okay. What doesn't it cover? It does not cover prescription drugs. It also does not cover routine dental, vision, hearing, eyeglasses, contacts, hearing aids, custodial care. That is a big one. A lot of people will say, well, my spouse, my partner, my sister has dementia. Well, can we have somebody come in and help them around the house with bathing, eating, things like that? That is considered custodial care. That is not covered by Medicare. And we stress to people, if there's 2 words people need to know, it's medically necessary. If it is not defined as medically necessary, it is not covered. It does not cover excess charges for services by doctors who don't accept Medicare assignment. And Medicare does not pay for care received outside of the U.S. except in certain circumstances. And you're probably thinking, I've seen all the commercials for the dental, the vision, the hearing. I thought Medicare covered it. I will explain in a few slides how they can get that covered. So how much is Medicare going to cost? The premium is $0, but there is a deductible. The deductible, and this is for Part A, the hospital. There is a deductible of $1,600, but that is where the Advantage plans or the supplements can come in. If I've had some people say, well, I don't hardly go to the doctor, so I'm not going to get anything. They are leaving themselves exposed for 20% of a bill if something happens. It also, $400 per day for days 61 through 90 in one benefit period, and there's an $800 cost per lifetime reserve day. This is all hospital related, and no, there is not an out-of-pocket limit. That is correct. So this year, people are paying $170.10, the average individual. This is the average individual for Part B. Next year in 2023, it is dropping down to $164.90. That is a monthly premium. Part B, which is the medical side, does have an annual deductible. Next year, it's going to be $226, which means if somebody is on Medicare A and B, whatever they do first, whether it's blood work, an MRI, a CAT scan, a doctor visit, that first bill, if it's a $400 bill, they're going to get a bill for $226. And then after that, the plan may cover the rest. 20% of approved amount for most covered services. Again, that is other costs, because Medicare Part B covers 80%. And no, there is not an out-of-pocket limit. So that is where we come in. People go, okay, if it's covering 80%, what do I do for the other 20%? And I will share with you that people will say, I'm still working, I have employer coverage, why should I look at any of these? What we recommend to people is that they do a comparison. That they do a comparison, they take the time to do a comparison of what it would cost to be on the employer plan versus what it would cost to go on a supplement and standalone prescription plan or go on Medicare with an Advantage plan. And many people come in and they go, I didn't realize this. So it is traditionally not a negative, and that's poor English, when we sit down. And the other thing, and some of you will smile, they say, will my employer be upset with me if I come off the employer plan? To which we respond, well, they may smile. They can't force you, but if you choose to come off, that is your choice.
One thing that you as the employer can help with in this, when the employees do meet with Kathy, you can provide them the benefits summary for their medical plan so that Kathy knows what benefits they have now and how she can best help them find coverage to meet the needs of the employee and their family.
So one of the options is a Medicare supplement. It is not required you get a Medicare supplement. However, you are exposed for 20%. It will help pay some of the out-of-pocket costs that come with original Medicare. And when somebody goes on a supplement, there is a monthly premium, whether or not they are using the insurance. Again, it is not required, but we recommend it. Then there is a standalone Part D prescription plan that you would get if you got a supplement. That is required. Congress decided in 2006 that even if you do not take any medications, if you do not get a Part D prescription plan, then down the road, you're not taking any meds now, or you take one and it costs you $3. Why am I paying for a premium for a Part D plan? Then down the road, you're on 4 or 5 and you need a plan. You would pay a penalty, or the individual would pay a penalty for every month they didn't have a Part D plan when they went on Medicare, and they pay that penalty the rest of their life. The good thing is there are many, many prescription plan options, and there are some as low as $11 a month. So that will help them to avoid the penalty. Or they can go on Part C, which is a Medicare Advantage plan. Part C does combine Part A, Part B, and traditionally in this area, it does include the Part D prescription plan, so the individual does not need a separate plan. And I will share with all of you, little did I know this when I got into the business, that Northeast Ohio is considered one of the hot spots in the country of Medicare eligible people. So the good thing is there's a lot of choices. The bad thing is there's a lot of choices. And where you hear the commercials for the dental, the vision, the hearing, the gym memberships, the over-the-counter money, that comes into the Advantage plan. You don't have to worry about explaining that to the individuals. That's where we come in. But if you wonder why it's in the Medicare Advantage plan, is not in with the Medicare supplement. So you heard me say that Part D is required. What is Part D? The average Medicare member takes 4.2 to 4.5 prescriptions per month. You can get them as a standalone plan, or they are incorporated to Advantage plan. They each have their own formulary. What is a formulary? A formulary is a list of medications that every plan has to cover. And I will share that Medicare requires every plan needs to cover 2 medications in every category. So that's in diabetes, high blood pressure, cholesterol, all of that. However, not all plans cover all medications, which is why we recommend that people get a prescription review before they choose a plan. There are network pharmacies, and now there are preferred pharmacies. What is that? Well, the insurance company will negotiate with the national chains, with United or Anthem, and say a Giant Eagle says, okay, Anthem and United, if you will present us as preferred, we will give a lower copay for a medication. So that is why there are network pharmacies, and then there are preferred pharmacies. Part D is offered through private insurance. There is a monthly premium. There are copays. The plan will cover the medication. However, there are prescription copays, and some of the plans have deductibles. This is where, when we say make sure that the plan you're on through work meets the definition of credible coverage in the eyes of Medicare, it really, Medicare, what they're focusing on is the prescription drug plan. It has to be as good as or better than what Medicare states is good prescription drug coverage. If somebody comes off of an employer plan and they're outside of their 63 days to join a Part D, then they would have a late enrollment penalty. So we recommend, if somebody's coming off their employer plan, to have the pieces and parts in place before the plan ends. When can I enroll? It's called your initial election period. It extends 3 months before an individual's 65th birthday and 3 months after. They apply for Medicare even if they're not ready to retire. What does that mean? That means that if somebody is, their birthday is in April 23rd, the first thing they want to know is their Medicare will start the first of the month. Medicare always starts the first of the month. Even though it's the 23rd, if they apply for Medicare, it would start April 1st. And they could apply 3 months before, January, February, March. It will not start until the month of their 65th birthday. If they miss the month, they have the month of, and they can go all the way through to 3 months after. And what does this mean? This means that they have guaranteed issue. No health questions asked. And for some people, that is a big thing because we do have people come in dealing with major issues and we go, we don't need to know because you are guaranteed issue. When can I enroll in a Medicare supplement? A Medicare supplement, by the way, is also a Medigap. People will say, I want a Medigap. And people will, I'll have one, the husband say, I want a Medigap, and the wife say, I want a Medicare supplement. They are talking about the same thing. They are guaranteed issue for a supplement up to 6 months after the month you turn 65 and are enrolled in Part B. And I call Part B the gatekeeper. If we do not, if they do not have Part B, they cannot go on a Medicare plan. And again, there's no medical underwriting if you enroll during this time. And yes, they can enroll later, but they could be denied or charged more based on health history.
Kathy, how long would an employee that is still currently working have to enroll after they quit working?
Well, okay, so there's an 8-month period for them to sign up for Part B. And then once they have Part B, they have the 6-month period, but they only have 63 days to get their Part D. So we recommend that at 63, why it's 63, I don't know. But it's really 2 months. Now, what is the special enrollment period? So a special enrollment is month after the last month of employment or employee health coverage. Again, they have 8 months to enroll in Part A or Part B. We do recommend that if somebody knows that they are coming off of an employer plan, that they do all of this ahead of time. But as you can see at the bottom, it says 2 months to enroll in Part C and Part D. Why Part C? Because Part C traditionally includes your prescription. I also tell people when they get the credible coverage form to hang on to a copy of it, because that is their proof that they had credible coverage when they turned 65 and chose not to enroll in Part B. Now, I will tell you, if somebody is not collecting Social Security, before we get into HSAs, if somebody is collecting Social Security, they automatically are sent their Medicare card. And if they don't want Part A or Part B, they can sign the back of it and return it. However, if somebody is not collecting Social Security and they want to go on Medicare, they need to sign up for Medicare A and B through Social Security. Got to take a sip of coffee before I go to the next one. So there's a lot of confusion about HSA accounts. The employee can contribute to the HSA up to 6 months before enrolling in Medicare A and B. To be able to contribute to an HSA after age 65, you must not enroll in Medicare, even if they apply for Part A. Now, if they are on where 2 of them, the HSA is owned by 2 of them, a husband and a wife, and the wife is not 65, we have been told by an HSA authority, the wife can make contributions, but the husband cannot if he's the one going on Medicare. At age 65, you can take penalty-free distributions from the HSA for any reason. However, in order to be both tax-free and penalty-free, the distribution must be qualified. It has to be a qualified medical expense. Okay, you can contribute to an HSA until you enroll in Medicare. Again, once you enroll in that Part A, you can no longer contribute. You may continue to withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses such as deductibles, premiums, co-payments, and co-insurance. This is where I'm going to turn it over to Mary Kay. She can speak to the FSA much better than I can.
Okay, the FSA, as you know, is an account that is provided by the employer as long as the employee is actively employed with you. So as long as they are actively employed, they can continue to make contributions to the HSA through payroll deduction, whether they're on Medicare or not. Medicare is not a determining factor like it is for the HSA. So even if they go on to Medicare, they will be able to make contributions into the HSA, right? The FSA, I'm sorry. Once they turn age 65, they can also use the FSA account to pay for things other than medical expenses. So if they have other, as you know, the FSA can be used to pay for medical, dental, vision, over-the-counter drugs. Anything other than that prior to age 65 would be prohibited. They can also use the funds from the FSA to pay for eligible medical costs for spouse and tax dependents, regardless of which medical insurance they're on. When your employee retires, they may continue to make contributions into the FSA, but that would be on an after-tax basis. So they would not get the pre-tax deductions like they would while they're an active employee. And they can continue this account. The account will remain open and eligible for them to make withdrawals from the account until the following March 31st. And just as with a normal FSA for actively employed individuals, if they don't file their claims for reimbursement by March 31st, they'll forfeit any money in that account.
All right, so this point right here can be very confusing for some employees. Decisions for Medicare eligible workers. So workers who are turning age 65 and work for an organization with fewer than 20 employees must enroll in Medicare as their primary health insurance. That is correct. If there are less than 20 employees, the employee who's turning 65 needs to go on Medicare. Medicare will be primary, and the company plan will be secondary, which is, again, where we will say, okay, however, if you choose to go on a Medicare Advantage plan or supplement, you are opting out of the employee plan, and you're going to be on your own. However, those working at organizations with 20 or more may choose whether to enroll in Medicare before retiring. Because when somebody goes on Medicare, when there's over 20 employees, the company plan is primary and Medicare is secondary. So if the company plan is primary and there's a large deductible, a lot of times they'll go, oh, you mean I can opt out and go on Medicare and I don't have to pay that large deductible? And the answer is no, they don't. So again, we highly recommend that people look at their options before making the final decision as to whether or not to stay on the employer plan or not. So I'm sure you've all seen the tons of commercials and so on the TV right now. This is annual enrollment. Medicare annual enrollment is when somebody who is currently on a Medicare plan can choose to make a change if they want to. They can switch from original Medicare to a Medicare Advantage plan, or they can go from a Medicare Advantage plan to a Medicare supplement. They can go from one Medicare Advantage plan to another, or they can join, switch, or drop a Medicare prescription plan. And we do recommend that for people who are on Medicare, that if they review nothing else at this time, they review their prescription drug coverage. And the time frame is from October 15th to December 7th. They can change a plan every single day during October 15th to December 7th. But whatever paperwork is at the carrier on midnight on December 7th is what they will have for January 1st. There are some additional enrollment periods. The special enrollment period is when you can make changes to your Medicare Advantage and Medicare prescription drug coverage when certain events happen in your life. What does that mean? That means that I've gone into a nursing home. I've come out of a nursing home. My spouse passed away and now my income has dropped. I was a resident of Florida. Now I'm in Ohio. There are a variety of plans. And when somebody is over 65, we get people who are 68, 69, and 70-year-olds who said, I've stayed on the company plan. Do I need to go on Medicare during October 15th to December 7th? The answer is no. They fall into what's called a special enrollment period. And yes, there are rules about when you can make changes and the type of changes you can make, which is where they don't need to know that. You don't need to know that because there are so many. That's where you can call us and we can help you to understand. There is another enrollment period. During annual enrollment, you will see a lot of commercials. It's annual enrollment. You can make a change, so on and so forth. You will not see commercials during the open enrollment period because Medicare has stated that the open enrollment period is not allowed to be marketed. However, it runs from January 1st through March 31st. It is where when somebody who's on a Medicare Advantage plan can make one change. Remember, during annual enrollment, they can change every day, but during the open enrollment, they make one change. And the Medicare Advantage open enrollment is only for people who are on a Medicare Advantage plan. That is the open enrollment, and people need to reach out to us. We are not allowed to reach out to them. That is considered marketing. So, what can you do to help people and make your life a little bit easier? We will help people. You can review your benefits. You can do a data analysis. However, you can also utilize Cass Company and the team. I have a team all throughout Northeast Ohio. And we even will do virtual like we are now for people out of the state to help educate Medicare-eligible employees about Medicare. And consider providing retirement Medicare educational seminars. Seminars have become very popular because so many people are of that age and they are still working. You can provide Medicare and Social Security literature handouts. We can give them to you if you want some. All you need to do is let Mary Kay and her team know. And we will leverage group health plan administrators so we can help you to understand if you have questions and want to do a comparison. And you can encourage employees to create a Social Security account, help employees understand how the company's retirement program works. Where can you direct your employees to go? They can call Medicare. And I will tell you, if they call Medicare to sign up for Medicare, Medicare is going to tell them to call Social Security. They do have to call Social Security to sign up for Medicare, but then if they have Social Security explain Medicare, they're going to say call Medicare. So it's rather confusing. State Health Insurance Assistance Program. There are people out there part of OSHIP. And I will say this because we've had quite a few people ask us the difference in the last 2 weeks. When an agent such as Cass Company represents a plan, we have to recertify every year for every plan we represent, and we have to get a certain grade or we are not allowed to represent or talk about the plan. OSHA people, as wonderful as they are given 22 hours of volunteer training one time. And we've had some people come in very frustrated because they were directed by OSHA to do certain things. And in the end, they found out that the direction they were given was not the proper direction. So if you ever want to know what the difference is, that is the difference. The other thing is I want you to know that there is no cost for us to come in and do an educational seminar. There is no cost for us to sit with an individual on a one-to-one basis. There is no obligation. If they choose to do a plan through us, the plan pays us. And if not, all we ask is pass our name on, because odds are if they're 65, they know somebody else turning 65. I think at this point, we're going to turn it over for questions, and hopefully feel free to reach out if in listening to this, you have questions.
So before we get to the questions, I'd like to add a comment here. As you, as the HR professionals are aware, healthcare concerns are huge for employees. The employees want to make sure that they and their families have the healthcare available to financially protect them. Medicare is an important part of their retirement planning process. When somebody is starting to think about retirement, Medicare should be a part of that retirement planning with their financial consultant. I recently seen some numbers that the average person in retirement age spends in excess of $250,000 in healthcare expenses. So, it's a good idea for everybody when they start talking with their financial advisors about retiring to involve CAS with that conversation so that the employee has an overall picture of how Medicare will fit into that overall retirement planning goal. So we do have some questions here. First one, Kathy, can I incentivize my employee to go on Medicare? Can I pay my employees any kind of monetary amount to come off of our group plan and go on to Medicare?
And the easy answer is no. We have been told by attorneys that the employer, cannot incentivize somebody. However, when they have somebody who sits down and does a review, a lot of times the employee finds out it's not as expensive as I thought it was going to be. So you can provide an educational seminar, and then we take it from there. But no, you cannot do that.
Okay, we have another question here. I have a spouse that's on disability. Is there anything I can do? I'd like to start that answer, and then Kathy, you can pick up. If the spouse is currently on the group health plan, if they are on disability, we encourage them to work with Social Security to start the Social Security disability process. That process typically takes about 2 years. So we want to get them to start working on that process as soon as they can. They can also, once they come off of your group plan, they can also enroll in COBRA. So they have the 18-month COBRA period, plus there's an additional 11-month extension for anyone that's on disability. So Kathy, is there anything else?
And that's a very good question, because a lot of times people don't realize that once somebody is on disability for 24 months, they are automatically eligible for Medicare. And once they have Medicare, then they can utilize the supplement or the Advantage plan, depending upon their age. If they're under 65, they can get an Advantage plan. They can't get a supplement in the state of Ohio. However, then when they turn 65, they are eligible for both. So if you have an employee who has a spouse that's on disability, I can tell you that people will tell me that can get expensive. Whereas if they utilize Medicare, and many times they don't know that they can do that.
Okay, thank you. We have another question here. What paperwork do I, as the employer, need to provide to an employee who is applying for Medicare? So when my employee is contacting Medicare or contacting CAS, what paperwork do I need to give them?
Well, if they are 65 and new to Medicare, the employer doesn't have to do anything, because this is their automatic enrollment initial election period. However, if they are over 65, there are 2 pieces of paper we tell the individual that they need. The first one is to get from the employer the letter, the form stating that they have had credible coverage. And if it's a couple, you need the form that states one person's name, and you need the form that states the other person's name. You can't have a joint form. Once they have that, then the individual goes and takes the application for Part B, and they go apply for Part B, and then we pick up the rest.
And that form for Fidelity clients, we send an email to you in September of every year reminding you that that certificate of creditable coverage needs to be provided to your employees no later than October 15th. That is the form that the employee would need for that to begin the process. Okay. Here's a good one. As an employer, can I pay my employees Medicare premiums if they choose to go on to Medicare?
I'm told no, they cannot. That's an easy answer. They are not able to. But many times, again, if somebody's paying $164.90 a month for Part B and they're not paying for Part A, that's less when they're traditionally paying on their employer plan. So that is usually not a problem for the employee when he sees that, he or she sees that.
Okay. Especially considering that on Medicare, there are so many different plan designs available that might fit the employee.
Well, and that's true because we live in a densely populated area of Medicare eligible people. We are, as I say to individuals, the good thing is you have a lot of choices. The bad thing is you have a lot of choices. Because they do. And more, when I got into this industry in 2008, the plans were not covering dental, vision, hearing. Now there are plans offering $5,000 dental, $3,000 for hearing. And an employee sometimes will come in and go, wow, I need to get my teeth done, or I need to get a hearing aid. I didn't know that this was available. That are some of the benefits. That is some of the benefits. And Medicare is a good thing. Many people are afraid of it because they don't know it. But once they sit down, we've had quite a few people come in who are very nervous and they go, I never realized that this is what it's all about. But again, they've been paying into it. If you've been paying into it, this is something you've paid into so you can utilize it down the road. And a lot of times it's a nice surprise when people find out about the cost of Medicare.
And Kathy brings up a very good point here that the whole process can be very intimidating, but Kathy and her agents make it very smooth and pain-free for the employee. Their goal is to find coverage that best fits that employee, whether it be that they have special prescriptions or special doctors. Their goal is to find that plan that best fits the needs of that person. Okay, Kathy, here's a good one. I have associates outside of Ohio. Could they still work with one of your agents?
Yes, we are licensed in 21 states, and we can do virtual, we can do phone, whatever. But we've done quite a few, especially now with COVID. So many people are now comfortable doing it either by Zoom or on the phone. So yeah, we can help people all throughout. And if you as an employer wanted us to come in and do a virtual with and include your out-of-state employees, we can do that.
Okay, another question. What if an employee decides to retire before age 65? I can take that one. If somebody retires before age 65, before they're eligible for Medicare, you can offer them COBRA, so they can be on your group COBRA plan. Or at the Fidelity Group, we can help them find individual coverage that would bridge that gap until they turn Medicare eligible. We can talk with them again about what doctors they go to. Do they go to Cleveland Clinic? Do they go to university hospitals? And we can find the best plan for them. So you can reach out to your account executive at the Fidelity Group and we can assist with that.
Another thing is people will say, oh, we spend time in Florida. Is that going to be a problem? Or we spend time in the Carolinas? No, there are plans to cover you if you're gone 2, 3, 4, 5 months at a time. So there are many plan options, and plans, people pick plans based on finance, medications, lifestyle. People pick plans for all kinds of reasons, which is again why somebody should take the time to review the plan that best meets their needs, because odds are their needs are different than their friends.
Okay, it looks like we've answered all the questions. We thank you for joining us today. If you do have any other questions, please reach out to anyone at the Fidelity Group or CAS. And again, Kathy and her team are available to help your employees navigate through the maze of Medicare. Thank you for joining us today.